I got here, I remember people saying, "What do you want to do?" And I remember telling them I wanted to walk out of here. And no one said, "Oh, that's silly. You don't realize how bad your stroke is. You can't do that." I figured I'm going to walk out of here.
Are you feeling stronger after therapies?
Yes, the therapies help very much.
In medical rehabilitation hospitals, we see patients who have generally sustained illnesses or injuries, sometimes catastrophic, and they come to inpatient rehabilitation for recovery and restoration back to the community.
Do you feel like you're getting stronger?
Yeah.
We bring together professionals, physical therapists, nurses, occupational therapists, speech therapists, as well as physicians. We treat patients who have had stroke, traumatic brain injuries, spinal cord injuries, and a variety of other neurological conditions, as well as patients who have had orthopedic surgery, trauma, and complex medical conditions. We look at the patient and we determine what individual treatment needs they have to optimize their recovery and get them home.
While I was hiking with my friends, I fall down 400 feet down to the cliff of the mountain.
We have your belt strapped on.
I don't have movement on my legs. I have limited movement on my arms. The therapists, their dedication towards the patient was something amazing. They want me to improve, and that's one thing that I like about them a lot.
Upon admission, each team member is doing an assessment and asking patients, what are your goals? And not only just asking that, but really helping the patient and the family to identify realistic goals so that there's not a disconnect between what the patient's expectation is and what is realistic in terms of the caregivers. Throughout this stay, we're reviewing patients' progress with both assessments and reassessments, and then changing the goals as the patient makes progress.
Really putting weight on your legs.
Patients can expect to receive 3 hours of therapy a day here, which may seem like a lot, but we do spread it out a bit. That means they receive a little bit of therapy in the morning, some in the mid-afternoon, and then sometimes even up to the evening hours. If we can get you for a shorter period of time with more therapy a day, we're going to get you home faster.
Good job. How's the shoulder feeling?
The specific type of therapy that a patient would receive in a medical rehabilitation hospital really is going to depend on their diagnosis. Our goal is to increase the patient's independence and to be able to get back to doing the things that are meaningful to them. So the intensity of therapy, but also the intensity of their medical care is much different than in other type of rehab facilities. We have physicians that are going to be rounding with our patients every day, and we have rehab nurses that are providing 24/7 rehab care.
There you go.
The first time I walked, I think I went 50 feet. But I remember they took me back to my room and I just broke down weeping. That's when the rehab became real. Every step was really a small baby step, but I knew that I was going to be okay.